the last section is an important section, and for those who are lucky enough to make it through, is how do we plan for discharge planning? And Dr. Costanza Martino is going to be talking about this.
Hi, thank you for the invitation. I'm an intensivist, so I will speak about something that is done from other type of doctor, because the discharge from the hospital is done from ward. But I can tell you what is doing in my hospital, because there isn't a protocol in Italy for the patient discharged from hospital. And there are currently no protocol in our hospital, for example, on specific tests. We use now clinical discharge criteria, and the clinical discharge criteria are absence of fever for 3 days before the time of discharge, significant clinical improvement, and symptoms start more than 10 days from the decision of the discharge. The negativization, the negative pharyngeal swab is not a criteria for discharge, only clinical criteria. And about the second question, does a patient need to stay in quarantine post-discharge? Yes, he had to stay in quarantine for 14 days after their discharge from the hospital. And where? Now they stay, if they are self-sustaining, if they stay at home alone, in a room, ventilated room, open window, but they have to stay alone. And if they are not so able for the self-sustenance, in our area, we live in an area called Romagna. We are organizing the possibility to have a quarantine in a hotel of the tourist coast. And what about the third question? Have you seen any readmission? Yes, we have seen. Now we don't have patient discharge from the hospital, intensive patients, only patients admitted to ward. But we have seen readmission when we discharge patients before 7 days from the beginning of symptoms. So we changed our protocol using the criteria of the 10 days. The fourth question, are you managing any COVID patient outside of the hospital? Now, no. And about the advice, the advice is to move faster than us, the improvement of resources, of facilities for these patients, for all the steps of the pathway, sub-intensive care pathway, ward pathway, and return to home. And another advice is to not discharge patients before the 10th days to avoid readmission, because it's not yet finished the adaptive immunity stage of the of this malattia, disease. Thanks.
Thank you, Dr. Martino. I'm going to open the floor for questions. So, Larry, if you want to field the questions from the audience.
Okay, we're still waiting for some questions to come in. While we're waiting for questions, I'll ask one. You know, it was brought up, I think, at the beginning that one of the unforeseen issues in this pandemic was actually discharge planning, and that was something that perhaps was unanticipated in terms of, you know, giving a lot of thought early on. What might you recommend to us here in the United States around the issue of discharge planning that we could focus on now?
You have to, per il discharge per la famiglia, per il paziente, you have to instruct very well the patients and the caregiver about this disease, these symptoms, but also how to stay in the isolation, in the quarantine. It's very important.
And
Not outside, yes. You have to respect all the rules to not to go outside from this room. You have not to have meeting. It's very important. Okay, because we are thinking to bring nurses to their home and not they to be, yes, because they are not alone. It's very important to organize a different type of treatment of these patients inside their home.
how would you relate discharge planning of a patient with COVID-19 to, for instance, other communicable diseases like, for instance, tuberculosis or other, you know, conditions? You mentioned a home nurse. Would there be things that would there be elements of discharge planning that we could plan for here that would benefit from supporting patients after discharge better, like home nursing or social work or other safety?
Nursing are very important. Yes, it's a solution.
How about telemedicine?
But now we have not data because we have few patients discharged at home. We have started now the war.
And do you find that once you you are infected or have gone through an infection that you then have immunity, or you no longer can get infected?
Nobody know. We don't know. We don't know when are not infected. You have two swarm negative. It's not so sure that you are not free from this virus.
Have you any experience in telemedicine with discharge planning?
No.
Patients using telemedicine?
No, in Italy not.
Thank you. This was very helpful.